How did you get connected with Thrive and Dr. Audrey? Tell us a little bit about your story.
I moved here to Colorado about a year ago, had driven cross country, and literally was just Googling to look to get an adjustment, possibly get a massage, and get some relief.
You walked into the office, but it was more than what you expected. Tell us about your experience.
It was. Over the last couple of years living in Massachusetts, and before that Erie, Pennsylvania, I had been a CEO working the 80-90 hour work week, feeling unhealthy and definitely gaining weight. So I'd walked in looking for basic relief, but then was told I was getting x-rays, that they were going to draw some blood and check various levels. Really, it was a pretty miraculous first couple of months with having more learned about my body and all the reasons I wasn't feeling well.
So that blood revealed that there was all kinds of stuff going on in your gut and all over your body that needed help.
Yeah, I had huge inflammation levels, which I didn't even know my blood could be inflamed at that point. It turned out I had 5 undiagnosed food allergies that were just causing extreme pain in my systems at time and all sorts of off balance. And just even figuring out those food allergies, within the first 6 months, I had dropped over 20-some pounds.
That's amazing. So Dr. Audrey, explain what was going on here with Audrey and what you do with functional medicine in your office.
Well, it's interesting. Anytime somebody comes in with a functional medicine need, we kind of like to get a big general picture. We don't specialize. We're super generalists. Take care of a whole list of issues. And so when Audrey came in, we said, what we're looking at is where are you off base from health? It's not necessarily looking at where are you sick. It's more of why are you straying from health? And so we looked into the blood to find out what the problems were, found the imbalances, and then just started to correct them one by one.
Because if you try to cleanse or detox yourself, but you're not doing the right things, it's not going to help your body, right?
There's a right order to things, for sure. Now, Audrey went through that process just as a superstar. I mean, it was amazing. She's busy. I think that's the really important part we notice here is that some people don't make changes in their life because they don't think they can. They don't think that they've got the time.
Sure.
And Audrey's just a perfect example of somebody who had no time, but still made it work. It's actually given her a lot of her energy back, which I think is really important to realize.
You're very active. I know you're out. Yeah. You have to have meals out. You're kind of on the run. You're that kind of person, but it's still working for you. Tell me about your life now and the year that's since you've met Dr. Audrey.
So I'm no longer working 80-90 hours a week.
That's good.
But I admit to like a typical 50 and sometimes a 60-hour work week. I'm the head of fundraising at Philharmonic. So it is the sort of thing where I'm out and about with lunch at donors, breakfast with donors, dinner or drinks with donors, the concert. They're not normal hours. So sometimes it was about making the intelligent choice, knowing that I'm highly allergic to gluten, never choosing the beer or choosing the wine if there needs to be an alcohol that's
And the
taken.
changes are beyond that. You've told me your energy, your sleep,
It's
all
so
of
much
that
better.
is improved.
Well, and it was the curvature in my neck had been completely off. It had actually started to curve forward and I didn't even know. So even going through training with Derek and functional movement, huge changes.
You're actually living. You're thriving now instead of surviving.